This is WCNY's The Capitol Press Room, and we're joined by Bill Gettman, CEO of Northern Rivers Family of Services, a Capital Region nonprofit helping 18,000 kids and adults navigate abuse, mental health needs, and a range of other demands. We spoke with Bill about his reactions to Governor Kathy Hochul's budget proposal. Well, thanks so much for making the time, Bill. I really appreciate it.
Great to be here, David.
Well, let's begin with a recurring issue, although it has a new name, but same issue, and this has to do with the cost of living adjustment that nonprofit providers are constantly looking for from the state to keep up with that cost of living, because everything, whether it's labor or keeping the lights on, gets more expensive every year. And coming into this year's budget, you were looking for a 2.7% cost of living adjustment. The governor, in her budget proposal, came out with 1.7%. Obviously not what you're looking for. What's the substantive difference there? What does it mean to have that 1 percentage point difference? Is it keeping doors open, or is it something that can be maybe papered over?
Right, it can't be papered over. Right now, our workforce is underpaid and our costs are going up. Inflation is going up, food is up about 14%, insurance is up north of 15% for most agencies, and our workforce has to pay their bills. So the governor did put in 1.7 in her budget, and we appreciate that. The cost of living for, as calculated by the federal government, is 2.7. So we need an additional 1%. That value is about $100 million. And that money is going to go into the paychecks and the pockets of our frontline workers who are woefully underpaid. At the same time, we're hoping that the additional 1% can help us reduce our turnover. Turnover in our sector ranges from 25 to 50% on what kind of work you do. And that has an impact on quality, customer service, and cost.
And when we talk about the work that's being done here, this is, in many cases, direct hands-on care for some of the most vulnerable in society, people with mental health conditions, people who might have a developmental disability, right?
These are people who work 24 hours a day, 7 days a week. These are folks who run the group home or the community residence, or go out on mobile crisis calls, or do mental health in the community. They are there hands-on despite the weather, despite the conditions, and we need them to be out there to protect our kids and families in the community. And then for those kids who need institutional or group care, they're the ones who take care of them on Saturday night at 2 in the morning.
So the budget process is a negotiation process, and one of the things that struck me when I heard the 2.7% ask was, why only 2.7%? Because one comes in high, one comes in low, you settle in the middle. Do you have any regrets about setting what might have been the more realistic number? Do you wish you had said, hey, let's do 4%, and maybe you land at that 2.7% number from the governor?
So there's a couple parts of that. One is we want to stay true to the cost of living increases. The 2.7 is the CPI. So there's a factual basis, because the budget folks always says, what's your rationale? And pulling it out of thin air doesn't really convince the policymakers.
But there's math you could lean on. You could say, well, you haven't kept up in those past years, so we got to make up for some of those years as well.
Right. Well, we want to be sensitive to the financial structure of the state right now. The budget is always a moving document. We would be happy to take 5% or 6%, as was suggested by some members in the legislative budget hearing process. But we want to be, we want to be honest stewards of the government's money.
Well, sticking with that idea of recognizing that there are limited resources, is there anything else you're looking for from the state in the budget process, or maybe a standalone bill that you think will make your operations either more sustainable or have other positive impacts?
I think there's ways to create some efficiencies in the delivery of services. We have a 9-point plan called Cut the Red Tape. Cut the Red Tape. And these are ideas that have been brought together by our social workers, our direct care workers, our associations. How do we make the delivery service more efficient? For-profit companies do this every single day. How do you improve your process to reduce costs, make the experience of dealing with you easier and faster, and make it more satisfying? So we have nine big buckets of items that we want to reduce the regulations. New York State has the second most regulations in the country, only to California. We have 300,000 regulations in the state, taking up some 3 million words. We can do a better job of delivering services if we cut the red tape. A couple examples.
Sure.
So first off, if you come to work for me, and we're going to give you a great background check and check your fingerprints and child abuse history and all those kind of things. But if you walk across our parking lot and work in a mental health program, we have to re-clear you again at the same cost, with the same rigor, with the same delays. That makes no sense. We have technology today, we have AI, we have smart people that can put together an employee passport, for instance. That makes common sense, saves money, and speeds up the hiring process, which helps clients. The other area we talk about a lot is the assessment process. If you come into our systems, mental health, child welfare, OASIS, OPWDD, you get assessed for what your needs, what your background is, what your mental health diagnosis. But if you move to another program or get a new clinician, that's going to start all over again. You have to do it over and over and over again. That traumatizes the family. It traumatizes the young person in care and adds delays to treatment. Let's come up with a common assessment that can be used across the systems, mental health, child welfare, and public health.
Well, generally speaking, then, what is the obstacle you're facing when it comes to cutting red tape? Is it just the fact that the status quo holds a lot of sway in Albany, or are there stakeholders on the other sides of these issues who will say, we have the assessment process for this reason, we have to clear people multiple times for this reason? Or, again, is this just the status quo and it's tough to move sometimes?
I think the status quo is a kind way of saying it.
Okay.
I think it's bureaucracy. I think it's people coming to the table with the position of the answer is no and we can't do it, instead of saying, what do we need to do to get through it? There are complications to this, but smart people can figure it out, especially with the leadership of the Division of the Budget and the Governor's Office to make New York a more efficient state.
So a big messaging for the governor this year is this idea of affordability, and one of the lenses that she's looking at this question through is car insurance. And insurance, whether it's cars or health, is constantly increasing, and New York pays a lot more than what people are paying in other states. Is this an issue for you, whether it is car, health, or other forms of insurance?
All forms of insurance are growing at incredible rates. Health insurance is growing by 15 to 20%. Car insurance is an issue because we transport clients.
Sure.
But the biggest issue facing us is the ability to get liability insurance for our agencies. We care for kids, we care for young kids, and the need for liability insurance has been a challenge. Many of the insurance providers across New York State and across the country have declined the provision and the selling of insurance to foster care agencies and to child welfare agencies because of risks. So we're asking the governor and the legislature to pass legislation to create an insurance risk pool and a transition plan so that our agencies can, in fact, have insurance at a reasonable price so we can continue to care for the government's kids.
Is this a recent problem, or do you feel like a frog in boiling water and it's just been getting worse and worse and worse every year?
This problem's been coming at us for the last 5 to 6 years. California has been hit with this problem, and it's led to the decline and the reduction of 19 agencies out there providing care. Pennsylvania has faced this challenge. New York is at the cusp right now of, if we can't buy insurance in the commercial marketplace, we can't provide services.
So I can't imagine this is a surprise to any of the agencies that oversee you, or maybe even the state lawmakers who work in this space. So has there been anything substantive from either a regulatory approach or from a legislative approach to address your concerns at this point?
We were talking to the Governor's Office, Financial Services, and the Office of Children and Family Services, but the legislature, both the Senate and the Assembly, has introduced legislation to create a risk pool for our sector. So we're hoping that conversation around the legislation, along with the budget process, produces a favorable result.
What if there is no action? I mean, does this mean providers are closing their doors, limiting their capacity? What's the outcome?
What's going to happen is when we go to bid our insurance and buy our insurance, if the insurance provider says no or says it's a 70% increase, as the case with one agency in New York City, agencies are going to have to make a decision. Do we stay in this business any longer? Kids are viewed as risky by the insurance companies, and these are kids that we serve in child care centers, foster care centers. They're the government's kids. They're our joint responsibility. So people have to step up and help solve the problem.
Well, lastly, in terms of meeting the needs of kids, there was a recent settlement that was approved to resolve an outstanding lawsuit having to do with whether the state was meeting the needs of kids who are on Medicaid in terms of giving them mental health services locally in their community as opposed to shipping them off to institutional settings. And the state mental health commissioner, Ann Sullivan, was asked about this issue during the legislative budget hearings, and she said that they are going to embark on an 18-month planning period to figure out how to go about meeting the capacity needs and delivering that care, and then a 2 to 3 year implementation window before those kids actually are definitely all receiving that care. By my watch, that means we're looking at 4.5 years of implementation. What do you think of that timeline?
We need to speed it up. We know what the problems are. The court brought sunlight to the issue. Providers have been out there talking about these issues, consumers, peers. The state has had numerous listening tours to talk about how do we solve some of the barriers to access to care. We need to speed up the planning process and implementation. We can't wait 4 years. There's wait lists in every community. Access is a serious problem. We need to put the best minds on this and get it done quickly.
Well, is there anything in the budget, aside from putting some money aside for the planning stage, that would begin to address this concern? Because I have to imagine something like higher Medicaid rates or any sort of other targeted investments to build out capacity would maybe get the ball rolling a little earlier.
So I think two things that can be done in the budget. One is to put in some rate adjustments on an interim basis to transition to the new system, because the new system will have higher rates because it's clearly underfunded now. And secondly, what can we do to support the workforce? Be it loan forgiveness, it's additional training support, it's simplifying the onboarding process, the scope of practice process that state ed currently implements. All those things could be done now, along with some money to transition the providers to increasing their access, adding more slots, speeding up the time to intake.
Well, Bill, thank you so much for making the time. I really appreciate it.
All right, let's cut the red tape.
And that was Bill Gettman, CEO of Northern Rivers Family of Services, a Capital Region nonprofit helping 18,000 kids and adults navigate abuse, mental health needs, and a range of other demands. Support for the Capitol Press Room comes from O'Donnell & Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com.